Okay, so all you need to know about cocaine. So, where does it come from? It comes from the coca plant, which is found in South America, high in the Andes Mountains. And in this plant there is an active compound that produces the effects that one feels when they're high on cocaine. So this is what the plant looks like, the coca plant. And this is where the little purple there is the Andes Mountains, and that's where the coca plant is found.
So, holy shit, no wonder it's all Colombian.
So then just an interesting fact, natives who lived in South America centuries before the 1800s used to chew on the leaves of the coca plant, but they're not nearly as potent as the concentrated form of cocaine that we know. However, it has been around for a very long time. So what is cocaine made out of? The chemical that is found in cocaine is called benzomethyllecholin, and it is not found in any other medication, so it's a natural substance and it is only found in the coca plant. However, there are medications that mimic the effects of cocaine in a way, such as ADHD medications, as they are also stimulants. And this is a picture of what the compound looks like of benzomethyllecholin. So cocaine, how long has it been around? So it first came around in 1884 in the form that we know it as in the white powder. Its use was promoted by individuals such as Queen Elizabeth and Sigmund Freud. He used to take it for his depression. At this point in time in the 1800s, cocaine was believed to help stomach aches, tiredness, boost energy, and aid the effects of tuberculosis. And it was also marketed to be a positive thing and a helpful medication by pharmaceutical companies. So there was nothing at this time that was negative with cocaine. So there's our Queen Elizabeth, and that is Sigmund Freud. So the cocaine timeline. So during the late 1800s, cocaine was also found in many everyday products. Can you guess what products had cocaine in them?
Coca-Cola.
Anything else? That is
Pepsi.
one.
Pepsi.
Nope, not Pepsi.
Baking soda.
Nope. Get off the pop topic. Think of something
I
else.
said baking soda.
Oh, baking soda. No. Any other guesses?
Craft dinner.
No. So it was found in skin ointments, which means that it was absorbed into that person's skin. So they were feeling the effects of cocaine by that. It was also found in butter.
Yes.
And then Coca-Cola as well, like you guys said. In 1903, cocaine was no longer advertised or in everyday items, but it was still used medically and promoted by pharmaceutical companies. In 1914, the government put a law in place banning the non-medical use of cocaine, and it wasn't much talked about or used illegally at this time. It was kind of on the down low, no one really cared for it. And then in 1988, the government passed another law stating that if one is in possession of cocaine, then they will be charged and required to fill their sentence in jail. The medical use of cocaine also came to an end because they realized that other medications helped the effects that they thought cocaine helped, and it wasn't harming people as much as cocaine does. And the use of cocaine in 1988 also went up, so more people started to abuse the drug again. So now, in 2016, cocaine is still illegal and serious charges apply. So if someone is caught in possession of cocaine, they can serve up to 7 years in prison. Obviously, that depends on how much they're caught with at the time. If cocaine is being trafficked, which means that it's being sold, that person could spend their whole life in prison, again, depending on the severity of the situation. If cocaine is exported or imported, which means it's sent between different countries, again, their whole lives could be faced in jail. And same with if they're caught making cocaine, they can have serious consequences as well. And all of these are charges all come with a serious fine. And if there's any money that is found that is suspected to be drug money, then it will also be seized, and that person will not get that money back either. So street names of cocaine. So these are the more common street names in North America. That's base, big flakes, big rush, blow, bump, C, candy, coke, cola, dust, flake, line, nose candy, pearl, powder, braille, snow, and tube, and white. So stimulants. So cocaine is a stimulant, and a stimulant is something that increases someone's alertness, attention, and energy, and it also raises their blood pressure, heart rate, and breathing rate. Stimulants can be addicting because of the way they affect the human body when taken. So stimulants are an upper. They make you feel good, which is why drugs like cocaine can be addicting. Stimulants can be used legally, like through ADHD medications, but only when they're prescribed by medical professionals. And taking an unprescribed stimulant is illegal. And abusing stimulants without a prescription and not using the proper dosage, they can kill. They can cause brain damage, heart attack, and they can cause you to overheat, which are all things that are not good. So how does cocaine affect your brain? So dopamine is a natural chemical that is found in the body, and when there's too much dopamine being produced, it can disrupt normal brain activity and communication. And dopamine specifically increases the levels of, so it impacts movement, memories, enjoyable moments, sleep, mood, attention, and ability to learn. So when dopamine is increased, all those feelings are increased. That's why you feel really, 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 really good. So normally dopamine is released naturally in response to possible rewards. So when you smell food, that like your body naturally, your dopamine levels rise, and that's why you're like, oh, it's dinner time, it smells good. However, when someone is abusing cocaine, they're raising their dopamine levels every time, but once they build a tolerance to it, they'll no longer feel the natural effects of dopamine, resulting in their addiction getting worse because they want to feel that good again. So this is just a picture of the brain. So this is a healthy brain. The yellow and red spots are healthy parts in the brain. And then this is a 22-year-old cocaine abuser, and as you can see, it's a darker color. It just means it's not as healthy and active as a brain that's not on cocaine. And you can see that the 22-year-old cocaine abuser brain is very similar to the 60-year-old Parkinson's patient brain, which is not good. Parkinson's is a really bad disease, and it
I know about it.
yeah. So not good. That's just a comparison of how serious cocaine can affect your brain. So cocaine also affects your body physically just as much as it affects your brain. So it impacts functioning with your blood vessels. It makes them smaller. It increases your body temperature, heart rate, and blood pressure. Abusing cocaine can also cause headaches, abdominal pain, and nausea. Cocaine is also known for inducing heart attacks and strokes, which can result in sudden death. A heart attack or stroke can be induced when cocaine is tried for the first time or after days, months, or years of abuse. So it's really like playing Russian roulette. You could have a stroke or a heart attack the very first time you use it, or you can have it years after abuse, but the risk is not worth it because it happens more often than not. So the way that cocaine affects someone's body physically is determined how they are taking the substance. So if they're taking it for absorption by placing it under their tongue or rubbing it on their gums, it can obviously lead to mouth diseases and mouth cancers. If they're inhaling it, also known as snorting, it can lead to the loss of smell, nosebleeds, problems swallowing, and a constant runny nose. Or if they're injecting it, it can cause severe allergic reactions and give the individual an increased risk for contracting HIV, hepatitis C, and other bloodborne diseases or infections. That one's obviously the most serious health-wise. And cocaine affects an individual also by causing them to be irritable, restless, and have paranoia and anxiety. So this is just a picture of someone before and after abusing cocaine. As you can see, it really deteriorates their face, it makes them look malnourished, and really just not healthy all around. So how's cocaine taken? So there's absorption, like I just said, placing it under your tongue or rubbing it on your gums. I couldn't find a picture of someone actually doing it, so this is obviously, you get the idea of that visual. Inhaling or snorting, injecting, and smoking. However, smoking is more common with crack, but people can smoke cocaine as well. So how long does cocaine stay in the body for? Cocaine typically stays in the body for 2 to 4 days. However, if the abuser is chronically using it, then it can last in their systems even longer, obviously, because if they're doing it every day, it obviously isn't like it's going to stay longer than the 4 days. When someone uses it regularly and then suddenly stops using cocaine, again, it can stay in their systems for up to 3 months because they were chronically using it that whole time. So specifically, it can stay in the bloodstream for up to 48 hours, and in the urine for up to 10 days. However, it doesn't actually enter the urinary tract until 2 to 4 days after using, and then it stays in your hair for up to 90 days. But it could technically stay in your hair longer than 90 days because it doesn't just stay in the roots of your hair. It actually, like, there will be particles of it all throughout, like, your hair. So it won't actually be gone until the hair is cut off or it falls out. And then those are just visuals of where cocaine can stay. And cocaine is eliminated, obviously, through urine and hair. However, the main way it is eliminated is through your kidneys. So what is the duration of it? So the onset of cocaine can be within seconds or minutes, depending on how it is being taken. And the duration of the high is approximately 90 minutes. So an example is if you're absorbing it, it takes approximately 30 minutes to affect you. But if you're injecting it, it takes seconds or minutes to affect you. So the onset times are different. However, the duration of the high is approximately 90 minutes no matter what way you take the substance. So signs and symptoms of someone being under the influence of cocaine. So if they have residue under their nose, obviously that's an indication, or if they have residue of cocaine on their personal belongings. If they have bloodshot eyes or dilated pupils, if they have needle marks on their arms, or if there's signs of drug paraphernalia lying around, like white powders, rolled up money, pipes, spoons, needles, etc. And if they have a frequent, or they're constantly touching their nose like this, it's also an indication. And another thing that a lot of cocaine abusers witness is the drips, and that's because, like, if they're snorting it, and that's because, so I actually found a picture. I couldn't find one specifically for cocaine, but it's very similar to when you have a runny nose or the flu, like, you know how you're constantly like, because it feels like it's going to fall out your nose. So when someone snorts cocaine, the substance in their nose, they feel like they need to, because they feel like it's dripping down their throat, and it does drip down their throat, and it has a really bad taste. Yeah, so that's just an example of how it looks. And then this is obviously just the paraphernalia that might give away if someone's abusing drugs. Needle marks.
My bloodshot eyes are different than his.
Yeah. So yeah, that's bloodshot eyes and then a dilated pupil, and sometimes people can have a mixture of both. They can have a bloodshot eye and a dilated pupil, or one or the other. So patterns of abuse. So cocaine is obviously very addicting, and it can lead to dependency as soon as 2 weeks after using for the first time. Cocaine is a drug that stimulates the brain's reward system, so it makes you feel good, which results in the user wanting cocaine more and more and more. And eventually, most addicts will go to desperate measures to get the drug, and they will push their food, water, and sleep and everyday needs to the side and put the drug first. Cocaine is a substance that the user will build a tolerance to, so over time the doses need to be increased for that user to feel the same or similar effects of euphoria that they felt the first time when they used. However, they're never going to feel the way that they felt the very first time they took it. And when they up the dose too, it also risks the chance of them having an overdose as well, which is not good. So physical and psychological indications of cocaine dependence. Psychological is just a fancy word for the way it affects you mentally and emotionally. So It can cause someone dizziness, fast and scattered speech, increased alertness and energy, increased heart rate, irritable, argumentative, and or depressed, malnourished due to lack of appetite, like you saw in that picture of the before and after picture. The girl looked very malnourished. Muscle twitches, panic, and paranoia. So symptoms of cocaine withdrawal. So luckily, cocaine withdrawal is actually rarely serious compared to other drugs. However, the side effects that someone feels when withdrawing from cocaine are very unpleasant, and they typically last for about a week or two. And these are some of the symptoms. So they'll feel like they're anxious, their body's going to ache, they have challenges in concentration, chills, depression, exhaustion, and intense cravings for the substance. And actually, cocaine is a drug that is known for people to try to quit, and then they fail, try to quit, and fail, try to quit, and fail, because the intense cravings are that serious that when people try to quit or go to rehab and get help, they often relapse because the cravings are that bad. So cocaine overdose. So for someone to live through a cocaine overdose or to live with a cocaine-related health scare or diagnosis can be very scary and traumatizing, obviously. And the more cocaine that is taken by an individual, the higher the chances that individual could experience an overdose. So, since I was talking about how you can build a tolerance to cocaine, obviously, over time, if you're upping your dose, then you're also upping your chance of overdosing. So if someone overdoses from cocaine, the effects it could have on their body is endless. Blood clots, heart problems, internal bleeding, lung problems, possible vision loss, seizures, and ulcers in the intestines or kidneys. And that's just some visuals. So that's an ulcer in the intestine, and they're really painful.
That's a blood clot.
Yeah, that's that one there is a blood clot. This is internal bleeding. So you can't actually, you'll just see the area, and you'll see that it's a darker color. Ooh, yeah. And then just heart pain. And then this is a quote. So, many cocaine users have a nothing bad will happen to me mentality, but the reality is that cocaine is one of the most dangerous drugs in the world. And again, most people don't realize this until it's too late. So signs of overdose and overuse of cocaine. So if someone's having abdominal pain, aggressive behaviors, if they're having anxiety, chest pain, dizziness, extreme mood changes, irritability, increased heart rate, blood pressure or temperature, restlessness, twitches and tremors in the arms and legs, and uncontrolled levels of energy. Now obviously all these signs and symptoms are common in a lot of other situations as well, and other diseases. So obviously if someone's experiencing this, you can't just jump to the conclusion of, oh, they're overdosing on cocaine. But obviously assess the situation and connect the dots and think, oh, are they overdosing, or is it something else? But this is what you need to look for. So how do healthcare professionals diagnose cocaine abuse? So healthcare professionals have a hard time diagnosing an individual who abuses cocaine because there's no test that can be taken that actually proves that someone is abusing that substance. They can do blood and urine tests. However, the blood and urine tests only prove that cocaine is in the system and not how much or how frequently it is being put into the body. So the other way that they try to assess the situation is they give the patient a screening test, which is just a yes or no questionnaire kind of thing to see what their habits are and kind of thing, just to screen if that person could be addicted to the substance or not. And they also do a physical exam and look into their family history and stuff to get more of a background. It is a harder drug to diagnose as an addiction because of this. And treatment for cocaine abusers. So there are 3 treatment categories. So there's behavioral therapies, which is like a basic counseling session. You go and it addresses the reasons and motivations and possible underlying psychological issues that are associated with that person's substance abuse. And then there's pharmacological therapies, which are drug-based. So the prescription is prescribed by a doctor, and it is used to treat that person's cocaine dependence. And the way this works is that the drug that is prescribed is a stimulant which acts like cocaine, and over time the doctor will slowly lower the dose so that person is slowly being weaned off the drug rather than trying to quit cold turkey. And then there's also rehab treatment facilities. Excuse me. So these are treatment options for drug addicts to put an end to their addiction and prepare them to re-enter into society. And drug rehab patients do their best to regain their normal lives in a safe and healthy way. Rehab facilities can be inpatient or outpatient, meaning that someone can live in the facility for a set amount of time, or someone can come and attend groups and meetings or what have you. Also, some rehab facilities are gender specific, meaning that they're boys only, girls only, or they're co-ed. And also some facilities are drug specific, so some may be just for cocaine addicts, for heroin addicts, or whatever. So how does cocaine affect a woman's pregnancy? So if a mother abuses cocaine at the beginning of her pregnancy, there is a chance that she could miscarry, meaning that she could lose the baby. If the mother abuses cocaine at the end of the pregnancy, it could cause a premature birth. And a baby who is born premature weighs less than 5.5 pounds, which is really, really, really small. And a baby could also be born with a smaller head and or brain. And also, if the mother is using cocaine throughout her pregnancy, it can also cause labor and delivery complications, which can put both mother and child at risk for complications as well. So the main risk factors that I just talked about above obviously are more common in women who have used cocaine throughout their whole 9 months of pregnancy versus women who, when they find out they're pregnant, they stop their cocaine abuse immediately. Obviously, women who aren't trying to get pregnant may be abusing cocaine, and when they do realize they're pregnant, it might be too late, because if these effects happen, like, they're irreversible, unfortunately. However, if they stop using as soon as they find out they're pregnant, the chances of a healthier baby are a lot higher. So how does cocaine affect the newborn baby? The baby experiences withdrawal symptoms as they become dependent on cocaine when the mother uses. They often shake uncontrollably, they're extremely irritable, they startle easy, and they cry the gentlest touch or sound. Babies who are dependent on cocaine are very difficult to comfort, and they're often referred to as withdrawn or unresponsive babies. And low birth weight babies are 20 times more likely to die in their first month. And if they do survive, they have an increased risk of lifelong disabilities, cerebral palsy, visual and hearing impairments. So I just have a little clip. Excuse me.
So what sort of
so this is just some babies. This isn't like for drugs in general, but
heroin to methadone. There isn't a baby here that has one drug in their system. They have 3, 4, 5, 6, 7 different drugs in their system.
So what are some of the typical withdrawal symptoms you tend to see a lot in these babies?
We see a lot of tremors, so their body's shaking. They do a lot of hand wringing and grabbing at their faces, crying and irritable, a real high-pitched cry.
How did you first get into drugs?
When I was 9 years old, my dad had got me hooked on heroin.
Once we got together, we just kind of went hardcore into everything that we could get our hands on.
Did you guys feel much guilt?
I'm ashamed of it all. Like, it hurt really bad. We both shed a lot of tears over this.
Ashley, right now, Brittany is in our studio. She's addicted to meth, marijuana, and alcohol, and she's had 2 miscarriages so far. What would you say to somebody like that?
You know that you're pregnant and you're messing around and doing drugs and thinking it's going to be okay. It's not.
Okay, so this is little Maxine. She just got here.
Mom was using methamphetamine. Apparently, Mom didn't know she was pregnant, so she didn't have any prenatal care.
As you can see, this baby has no subcutaneous fat, and she was basically starved in the womb.
This is Susie. She's been here 3 weeks, and unfortunately, she has not had any visitors.
So nobody's come and seen her for 3 weeks? How somebody can have another life inside them and just not care to do what they need to do to just get off, just normal it for the baby's sake. I remember being such a proud papa, and now that little girl's driving a car around. I don't get to see her much anymore. I bet your mama's missing you too, deep down. I bet she is.
Okay, so obviously that video was for drugs in general and how they affect babies. But again, they all pretty much have the same effects on newborns, and it's really not fair to the baby to be born into an environment already addicted to such a severe substance, because they don't have any control over it. There are studies being done presently on babies who are born addicted to drugs and to see if they have a higher chance of being abusers in the future. However, there are no results on those studies yet because those babies that they're following around for the study haven't grown up yet. So I'm sure in time there will be results as to see if babies born addicted do have a higher chance of being addicted in their futures as grown adults. So cocaine abuse and the risk of HIV. Obviously, when cocaine is taken, it puts the user at risk of HIV through sharing needles and pipes. However, that's not the only way it can be contracted, because when someone is high on cocaine, it does impair their judgment, which can result in risky sexual behavior. And again, that can also result in pregnancy, and we just learned that there's severe effects for both the mom and the baby. So then there's risk factors of cocaine are that there is crack, which is poor man's cocaine, and it's not as pure as cocaine, and it's also cheaper. So when people can't afford cocaine anymore, it's a risk factor because they're purchasing the cheaper version of it. And both cocaine and crack are very easy to get. And then the side effects, obviously, the physical, psychological, and emotional side effects that come along with taking cocaine are risks in themselves. However, there are protective factors and harm reduction factors that are in place. So cocaine is very expensive, which is a protective factor in a way because not many people can afford it. There's safe injection sites where people can go and use safely. And then there's also safe injection kits and safe inhalation kits. So this is just a picture of crack versus cocaine. As you can see, crack's like a darker color. It's not as pure and nice looking as cocaine. That's an example of a safe injection kit. And this is actually the safe injection site in Vancouver, British Columbia. So the way this one works is, there are health professionals who actually work there. The way it works is the abuser comes in with their substance, they give it to the healthcare practitioner. The practitioner then injects the substance into their arm or leg or wherever it's being injected.
Something to it to make it addicting?
Nope. So the rule is when you go, the user cannot leave until their high is gone. So it's not like they can go and get high and then leave and go on with their day. They have to stay there until their high is gone in case they overdose or if there's something that needs to be looked after medically. That's the end of my presentation, but I went to PAR in Peterborough, and I actually picked up a safe injection kit and a safe inhalation kit just to show you guys.
Can I have it?
No. What they consist of. If you guys ever need something like this, I will give you a card of where to go. I will not be providing it for you myself. I just want to show you and educate you on this because I do know that drugs are out there, and even if you know people who are abusing crack or cocaine, inform them that there is somewhere in Peterborough, right downtown, where you can go to get a safe injection kit or a safe inhalation kit. Again, like if they're going to use, they're going to use, but it's just, it's safer if they're using with cleaner kits and they're protecting themselves. So this is the safe injection kit. So this is just like one example, but the kit itself comes with 10 needles, 5 tourniquets, 10 alcohol wipes, steri cups, 5 of those, extra filters for the needle. It comes with condoms and lube, also to promote the safe sex, so HIV isn't being transmitted. And oh my god, And so also unexpected pregnancies aren't happening either. So the way it works is you would take the little alcohol wipe and you would wipe the area where you're going to inject. It is recommended to just wipe and to not go like this, because if you're going like this, it's going to move all the dirt around and it's not really disinfecting the area. Then, so it obviously comes with a needle, clean needle, which you wouldn't share obviously because that's the point of the safe injection kit. So then it comes with a steri cup. So this is, I'll come over here and I'll show you guys so you can see better.
I know about the stuff my mom used to get it.
So,
Can I see the needle?
pardon? No, Rody, just wait until after, you guys can see it after. I'm going to explain how it works. So this is a steri cup. So you would put this on, this is the little handle, you'd put the drug in there, okay, and then you would put the sterile water, which it comes with. So people, sometimes they'll use their urine, they'll use toilet water, puddle water, really any liquid they can get their hands on to mix in with the drug. However, these kits come with sterilized water, which is cleaner than tap water and bottled water. So it's really good to use this water. So you mix it in with the drug, you heat it up, and then you take the filter, and then you put the needle into the filter and bring the substance up. So when the substance is being extracted through the filter, if there's any like loose particles or flakes of the substance, it's not being put into the needle and being injected. So that is the safe injection kit. When I'm done my presentation, you guys can come check it out at the table.
The needle?
No. Also, you guys can check this out after too. It's just a safe injection guide of where not to inject and where the recommended places are to inject.
I can't believe people are actually allowing you to do this.
It's harm reduction.